Care ethics is a moral theory that emphasizes the importance of relationships, compassion, and responsibility in ethical decision-making. Unlike theories that focus on abstract principles or rules, care ethics prioritizes the needs of individuals and the social context in which moral decisions occur. It argues that ethical behavior is rooted in empathy, nurturing, and attentiveness to the well-being of others. Care ethics is often applied in personal relationships, healthcare, education, and social work, where understanding and responding to the needs of others is essential. Rather than following strict moral rules, care ethics encourages people to consider how their actions affect others and to act with kindness and responsibility. Now let's look at some examples of care ethics in real life. One example of care ethics is a nurse who goes beyond basic medical duties to provide emotional support to a patient, recognizing that healthcare is not just about treating illness, but also about addressing human needs. Another example is a teacher who adapts lessons for a struggling student, showing care by recognizing that fairness does not always mean treating every student the same way, but rather providing support based on individual needs. A third example is a family member who takes care of an elderly relative, ensuring that they feel valued and respected, rather than simply fulfilling an obligation. In all these cases, ethical behavior is guided by empathy and a commitment to fostering meaningful relationships. Now let's explore some strengths of care ethics. One strength of care ethics is that it values emotional connections and recognizes that ethical decisions are often influenced by relationships rather than abstract principles. This makes it more practical in real-life situations where personal connections matter. Another strength is that care ethics promotes empathy and compassion, encouraging people to consider the feelings and experiences of others when making decisions. Additionally, care ethics challenges rigid moral frameworks by emphasizing flexibility and responsiveness to different situations, making it more adaptable to complex ethical dilemmas. This approach allows for moral reasoning that considers the specific needs of individuals rather than relying solely on universal rules. However, despite its strengths, care ethics also has some weaknesses. One weakness of care ethics is that it lacks clear guidelines for making decisions, as it focuses on personal relationships rather than objective moral principles. This can make it difficult to determine the best course of action in situations where different people have conflicting needs. Another limitation is that care ethics may lead to favoritism, as individuals might prioritize those they have close relationships with, rather than considering fairness and justice for everyone. Additionally, care ethics may place a heavy emotional burden on individuals, expecting them to take on responsibility for the well-being of others without clear boundaries. These weaknesses highlight some challenges in applying care ethics consistently in ethical decision-making. Now let's consider some alternative ethical theories. One alternative to care ethics is utilitarianism, which focuses on maximizing overall happiness and minimizing harm, rather than prioritizing personal relationships. This approach provides a clear method for making ethical decisions based on outcomes rather than emotional connections. Another alternative is deontology, which emphasizes following moral rules and duties, regardless of personal feelings or relationships. This ensures that ethical decisions are based on principles rather than subjective emotions. A third alternative is virtue ethics, which focuses on developing good character traits, such as kindness and honesty, rather than relying on specific rules or relationships. While care ethics highlights the importance of compassion, these alternative theories provide different perspectives on how ethical decisions should be made.